Welcome to Health Digest, your weekly deep dive into the world of health, medical advancement, and well-being. I'm Ogom Ezedimbo, and today we'll bring you an important update that marks a significant milestone in the fight against one of Nigeria's deadliest diseases, malaria. For decades, malaria has posed a serious threat to millions, especially vulnerable children under 5. But today we are one step closer to controlling and eventually eradicating malaria in Nigeria. The introduction of a malaria vaccine, R21, in our routine immunization schedule promises to be a game changer in reducing both morbidity and mortality rates. Let's bring you all that happened during the launch of the R21 malaria vaccine.
Nigeria is embarking on an ambitious plan to fight malaria with the introduction of a vaccine that is specifically designed to protect children under the age of 1. This effort is spearheaded by the Ministry of Health and Social Welfare with Professor Mohammed Ali Pate, the coordinating minister at the helm.
When we have received the first malaria vaccines in Nigeria, marking a new beginning in our efforts to deal with malaria, an important scourge in our country. As you recall, 10 months ago, the President unveiled his health sector renewal agenda. The focus was to save lives, to reduce physical and financial pain, to produce health, and to do it for all Nigerians. He focused on improving governance, and we are working closely with states, with local governments, with development partners in a sector-wide manner to mobilize the resources to channel our efforts to solving the needs of Nigerians, especially the poorest and most vulnerable. And the second element of it was to do the things that matter to improve population health outcomes. While we're expanding primary health care, we're also tackling diseases like malaria that constitute a large burden. And in that regard, you will recall my colleague and I, the Minister of State for Health, Dr. Tunji Alausa, and myself, convened a rethinking malaria effort in early May and discussed what are the ways that we can reboot Nigeria's malaria effort. And we came up with certain strategies that include optimizing the tools that are available to us: bed nets, seasonal chemoprophylaxis, intermittent presumptive therapy for malaria, expanding case management, and layering on top of it newer tools like vaccines, and tailoring our efforts to different parts of the country. What is happening in Zamfara is different from what's happening in Lagos. What's happening in Kebbi may be not the same as what is happening in Bayelsa. That took place in May. So we're on that journey, and we set up a malaria elimination task force, an advisory group that comprises internationally recognized experts, what we call AMEN, the Advisory Group of Malaria Elimination on Nigeria, which has been activated, and the task force is active, and in fact it will be meeting again in 2 weeks. So this is one more marker in our journey to deal decisively with diseases like malaria that afflict millions of our children, women, and general population that have constituted a huge burden not only in lives but also in livelihoods, in the economic impact of this. So as part of this effort, there are other vaccines that we're also ramping up. HPV, launched in October. Nigeria has been the best performer when it comes to coverage of HPV, thanks to the partnership between the government, the civil society, the members of the media, traditional leaders, religious leaders, and our development partners. Now we have malaria vaccine. We had meningitis earlier this year. Again, we were very fortunate to be the first country in the continent to introduce the first pentavalent meningococcal conjugate vaccine, and that outbreak was stopped. Cholera was a problem a few months ago. We received millions of doses of oral cholera vaccine. In fact, Borno, we were able to deploy some in Yobe and other places, and thanks to the ICG, to our partners, WHO and UNICEF and the Gavi Alliance and other development partners, we were able to stamp it. Diphtheria was a major issue. We used vaccines to stop it. So I'm recapping this to share with us the miracle of vaccines. You take them, they prevent children, they prevent adults from getting disease. Mpox, we received the first 10,000 doses of Mpox vaccines, thanks to the US government in the continent. And we, in fact, donated part of it to one of our sister African countries while we were trying to get more. So we have, under the leadership of the President, repositioned Nigeria's health system, but also focused on the things that matter to Nigerians. And the miracle of vaccine is one of them, because it can prevent diseases from happening. But vaccines are also an opportunity, because for every child, every girl that gets HPV is an opportunity to live a life free of cervical cancer. Every child that has full course of malaria vaccines has an opportunity to live a life of health. A child that is immunized against measles has an opportunity to live a life free of that disease that could be very debilitating. So it's a miracle, but it's also an opportunity. That is a story of this President's Renewed Hope agenda in our country. And so I want to thank again our partners for making this possible. Finally, vaccines are delivered to population free. They are safe, they are efficacious. But they are free at the point of use, but they cost money. So someone is paying for it. And that someone is the government and our development partners in the Gavi Alliance, who mobilize the resources and put together to provide these vaccines. They are not enough. They are not enough vaccines. So in the context of not enough and it's free, I want to urge all well-meaning Nigerians to take advantage of the limited availability and the fact that these are valuable commodities and bring their words where they have the opportunity to make sure they are protected with these vaccines, and to discount misinformation for uninformed people who sometimes have their own agendas or may not understand what they're talking about, to cloud people's minds and prevent them from receiving something that is of value to them. So the media has an important role to play, and Antimoji laid it out, just like Dr. Kazadi. We have to continue to emphasize. I also want to assure you that the traditional religious leaders have been with us on this path since the polio days, and they are still with us. We thank them, and we continue to interact with them in a very constructive way, because they are custodians of our cultures, of our traditions, and they are respected by our population, so that we navigate these issues together to bring benefit to our people. The third plank of our agenda is to unlock the healthcare value chain, and I'm glad Eduardo mentioned it. Hopefully over time, Nigeria will get to that point. Until then, we'll still have to get those vaccines from somewhere else, tested to be sure they are okay, and also delivered deliberately to our population. And finally, on the health security, the infrastructure that we have for delivering these vaccines can also help us if there is an emergency. Just as it helped us during cholera, during meningitis outbreaks, with diphtheria, with COVID-19, with Mpox. This infrastructure that we have, whether it's a cold store, the logistics, the trained health workers, the community mobilization, and the partnership that we have, will ensure that we safeguard our population. So all in all, it's a great day. It's another marker in terms of the transformation that this president is leading this country, despite all the challenges that are prevailing. I want to thank all of you sincerely for being with us as we mark this day, and thank you, ED, MPH, CDA, also with your team, because you have been very relentless. I would like you to clap for yourselves. Because the ED, with his amazing team, have worked closely with the state government, with state primary healthcare agencies, with development partners, really doing the nuts and bolts. As the minister, I sit around, but they do all the hard work and the heavy lifting. So I really want to thank the ED, MPH, CDA, and his entire team for really keeping this movement going. So you must all be proud as MPH, CDA staff, and we are also cheering for you for more success.
The R21 malaria vaccine rollout is set to begin in November 2024, with the first phase focusing on Kebbi and Bayelsa states, where malaria prevalence is highest. During this phase, over 800,000 doses of the malaria vaccine will be administered to infants as part of the country's routine immunization schedule.
State governments will also step up and find ways within the increasing revenues that they have, how they can complement federal government in terms of co-financing these vaccines, so that over time we would be sustainable in the way we fund vaccines, not for the children of today, but also the children of the future. From the federal government, the President has prioritized the wellness of the Nigerian population, particularly our children, our women, and I know that the Minister of Finance is working very hard to ensure that all the co-financing obligations from the federal government are met. But the subnational level will need to do more in terms of helping meet up those costs so that the availability of these life-saving vaccines, especially for the poorest and most vulnerable, will be a reality. Because there are folks who can be able to afford these vaccines from their own pockets. But the children of the poor in rural areas are the ones that may not be able to access them. That's why we have prioritized public financing in that regard, and we thank our partners for contributing towards it. The issue of misinformation, disinformation is the nature of the landscape that we have with social media and so-called experts who have no basis for that, no scientific basis, spreading really unfounded rumors, sometimes from outside the shores of our country, when in their own country, almost everybody is fully vaccinated. And we have seen the value of vaccination. When it comes to polio, we are able to interrupt it. When we go to measles, 99% of children who have measles vaccine don't get measles. When it comes to diphtheria, 99% of children who have been immunized against diphtheria don't get it. We've seen with HPV, Nigerians did not listen to those misinformation sources. More than 90% of the cohort were vaccinated. That means Nigeria became the top in the world, which means that we are getting through to Nigerians with the information that we have, the mechanism that we have through MPHCDA, through our development partners, through some of the media who are enlightened and understand credible sources of information to go to. And our religious leaders, the Sultan of Sokoto, all the religious leaders in our country, the traditional leaders, especially in the north, have really leaned in to educate our population so that people understand that this is of benefit to our population. Otherwise, we have needless suffering, loss of life from diseases that can be preventable, that are not prevalent in other parts of their countries that have eliminated malaria. So if we make our minds as Nigeria to move forward in this direction, we can succeed. That is what President Tinubu wants us to do. And both myself and the Minister of State for Health are really focused on ensuring that we deliver improved population health outcomes with our agencies, so that MPHCDA, NHI, and many other agencies of government under the Federal Ministry of Health and Social Welfare to ensure that we work with others, states, development partners, to deliver on this objective.
Professor Patti highlights that this initiative is a critical step towards achieving a malaria-free Nigeria, and it wouldn't have been possible without the support of global partners like UNICEF, Gavi, and the World Health Organization.
For us, the malaria vaccine is a very important tool. You know that more than 500 people die every day in Nigeria because of malaria, most of them children. So we are extremely happy to see what is happening today with more than 800,000 of vaccines of malaria available. Transportation and storage is a key issue. How you can ensure that the cold chain has the integrity needed to keep safe the vaccines and to keep them effective. But we are confident and we know that we have the capacities, the Federal Ministry of Health and NPHCDA, they have the capacities to store them and to transport them. One example is what we are seeing here today. In our right, this is the National Cold Store. That is, the cold store is almost finalized, which has tripled the capacity to store vaccines here in Abuja at national level. And what we are seeing over the last year is like the capacities to store cold chain, to store vaccines have doubled in the country. So we believe now we have the capacity to maintain the vaccines safe and effective for the children that they need it. And we are looking forward to see the impact in Bayelsa and in Kebbi. We know that Bayelsa has some, it has like a riverine, has a lot of rivers. It's a complicated state, but strengthening primary health care, we are sure that we'll be able to deliver the vaccines to the children that they need it.
With respect to people coming down with malaria after taking the medication, it's an assumption that it is malaria. The first biggest challenge is that people need to get tested to be sure they have malaria. Now, but talking about the level of protection of this vaccine, we expect it to offer at least some 77% protection and additional 30% reduction in severe malaria. When you combine those two figures together, then you can appreciate by how much percentage we're likely to be able to reduce both our malaria burden as well as malaria deaths.
The malaria vaccine is safe. The malaria vaccine is efficacious. It has been proven in other countries, and the WHO Strategic Advisory Group of experts on vaccine and immunization have validated that evidence. So I'd like to really use this opportunity to call upon all sectors of the society, the judiciary, the communities, the NGOs, the member of the press, others, please spread the same news. We are ready to provide the evidence if we want it. The vaccine are safe. We need to protect children. We need to protect the youth. We just concluded the Summit of the Future in New York. We all agreed on the roadmap. And the part of those efforts is to ensure universal access to vaccine for all those who want it, starting with the youth, who are our future. So we stand ready to provide any evidence to debunk all those news we are seeing in the social media. Vaccine is safe, vaccine is efficacious. The malaria vaccine is safe, is efficacious, and it has been proven with strong evidence.
The vaccine itself requires 4 doses to be fully effective, and its incorporation into routine immunization will ensure long-term protection for the most vulnerable.
Here is a new and refreshing offer for our esteemed audience across the globe. The new AIT Cloud TV is an online streaming service that offers you attractive opportunities to view our rich, exciting, and entertaining programs anytime, anywhere. AIT Cloud TV is available on the web on www.ait.app, Apple TV, Amazon Fire TV, Roku, and Android TV. You can also download the mobile app from the Google Play Store or the Apple App Store. Simply connect to the internet, download the app, register, and watch live or catch up on unlimited hours of exciting shows. AIT Cloud TV. TV on the go.
To explore the vaccine rollout plan, the impact it can have, and how global collaboration has been crucial in this endeavor, let's bring you an interview with the Executive Director, National Primary Healthcare Development Agency, and Dr. Muyi Aino, where he spoke about how the agency intends to monitor the effectiveness of the R21 vaccine in reducing malaria cases and what metrics will be used to measure success, and also how they intend to counter any concerns or misconceptions regarding the R21 vaccine. He spoke during an interview the News Hour on AIT.
Thank you very much, and good evening. You did mention earlier that we received the first dose. I think today was a remarkable milestone in the effort of the government to combat perhaps the most ravaging condition. I think everybody will agree that malaria is a priority illness for Nigerians. 840,000 doses is not enough to go around the country. I think it's important that we realize that this vaccine is not in abundant supply just yet, so Nigeria is very fortunate that with the leadership of President Bola Tinubu, but also the coordinating minister for health, we were able to work with our partners to be the first country, one of the first countries to actually access these vaccines. So the 1 million doses in all that we will get is not enough to go around. So we decided to prioritize based on the highest burden locations. I mean, the prevalence of malaria in Nigeria is very high overall, but it ranges up to 52% in states like Kebbi. So we have selected Kebbi State and Bayelsa State as the first states to get this round of the vaccines. And now that we have taken custody, we already have a rollout plan, and Nigerians can expect in those states to start to access the vaccines within the next couple of weeks.
So how will the agency monitor the effect of the R21 vaccine in reducing malaria? And then what's the metric that you're going to use to measure the success?
For as with any new vaccine introduction, which we have quite a bit of experience. I mean, in the last couple of years, we've introduced rotavirus vaccine, we have introduced the pentavalent meningococcal vaccine, and most recently, we introduced the human papilloma virus vaccine to the routine immunization schedule. And we've learned a lot in that process. I think the engagement process, pre-introduction, but also monitoring very, very carefully, when we roll out. There's what we call the cohort effect monitoring. So we're working very closely with NAFDAC, with Nigerian Centers for Disease Control, our sister agencies, to really track a number of things in the field. One is just acceptability and utility of the vaccine itself. The second is the effectiveness of it. And to measure the effectiveness of the vaccine specifically, we're doing a cohort analysis in collaboration with the manufacturer, Serum Institute of India, with NAFDAC, with some of our academic partners. We're doing a whole effectiveness study. We would also be monitoring adverse events. Where this vaccine has been tested and certified to be safe. It's been used in other places, but also NAFDAC has passed it, as fit for Nigerians. But still, as with every medicine, we pay a lot of attention and track for adverse events. So the metrics we will be really using to measure success is one, the overall effectiveness of it in the population. Basically, how practical is its administration to people, how acceptable is it to people, and then ultimately when people do get it, does it, to what extent does it fulfill the promise of reducing the burden and the impact of malaria in the recipients?
Now, with all the things you said about the vaccine being tried and tested, that there are definitely a lot of misconceptions. We've heard of fast vaccination exercises in the past where people have been reluctant. Do you have anything online, like an awareness campaign, to let people know that it is as good as you're making?
Absolutely. I think, in the world that we're in with a lot of misinformation in the real and social media, I think it's very important that the advocacy and communication is done properly. And we're working with the states that are starting up, but also with a lot of our partners. And of course, you, our friends in the media, to really package and put out the correct information. There will be misinformation. There will be mischievous folks who want to make up and disseminate information. But I think we have a joint responsibility to identify very quickly, but also to respond and communicate to Nigerians what is true. I think partnership with the communities is very key here. And that comes in forms of our religious houses, the churches, the mosques, It's okay to ask questions. We're happy to answer questions, but let us take positions that are based on evidence and facts. Absolutely. Let us ask, let us check, and let us, spread news and information that is based on evidence. Our religious leaders, our traditional leaders, our CBOs, the community-based organizations, and very importantly as well, the media. It's very important that, you help us to put out the word out to people, yes.
Malaria is a preventable disease, yes, but in Nigeria it continues to claim thousands of lives each year. The introduction of the malaria vaccine gives hope that in the coming years these tragic statistics will begin to decline. But the vaccine alone, like the speaker said, is not the only solution. It must be part of a broader strategy that includes preventive measures like the use of insecticides-treated bed nets, indoor spraying, and improved health services. We all know now that this vaccine rollout has the potential to save countless lives and reduce the burden of malaria on our healthcare system. However, it is for it to be successful, parents must bring their children in for all doses of the vaccine. This is not just a fight for the government or healthcare professionals, it's a fight for all of us. Together, we can make malaria a thing of the past. That's our package for today. And remember, your health is your wealth. Until next time, stay safe and stay healthy. I'm Ogom Izedimbo.